Good morning and welcome to the annual North Central Mass Prevention Conference. This year, our conference takes the form of a school health and wellness summit, and we will be learning together about using student survey data to inform school-based health curricular and programmatic supports. The program this morning is sponsored in part by the Health Equity Partnership of North Central Mass, also known as Community Health Network Area 9, or CHNA 9. This community coalition brings together diverse voices across the 27 cities and towns of North Central Mass to work collaboratively on policy advocacy, institutional practices, and cross-sector solutions to systemic health inequities. This program is also sponsored by the North Central Community Action Team and the Gardner Community Action Team, coalitions that focus on substance use prevention and education in our communities, and by Luck Inc., a not-for-profit social service agency dedicated to improving the lives of youth and their families, offering a full spectrum of programs addressing mental health, trauma, addiction, and substance use prevention, homelessness, and more. Our keynote speaker this morning is Dr. Mark Pellegrino, Superintendent of Gardner Public Schools, who has led his district through a system-wide commitment to collecting and responding to youth survey data. This has led to changes in staff responsibilities, new evidence-based curriculum implementation, and partnerships with community-based organizations. The results have been remarkable, and Dr. Pellegrino has spoken across the state and across the country about their journey. Please join me in welcoming Mark Pellegrino. And I don't know if I gave you the permission to speak, did I? Let's see. Olin, I think you have the hosting ability to allow Mark to speak.
Should be able to speak now.
Hello.
We can hear you, Mark.
All right, great. So I don't know if you want, I have slides, I can show slides, or you want to do that?
Yep, is your share button available to you?
No, join as a panelist.
There you go.
There we go.
If you're in as a panelist, Mark, do you now have the ability to share?
Whiteboards, share screen, okay. And let's see. Why isn't that coming up? Okay, my apologies. Let's see if this works.
Looks good.
Okay. So you can see that?
Yes.
Okay. Great. Well, thanks for having me. I'm always happy to talk about the work that my folks do when it comes to using data to inform our decisions throughout the district. How we do that. We've been fortunate enough to be asked to speak, at national and international conferences because of some of the work that my folks have done. We've really tried to make this a system, and so I'm going to talk about this. And frankly, I could talk about this for 4 hours, if quite frankly, but I want to keep this obviously to a reasonable amount of time, and I want to talk about it in a little bit more of a story form rather than just the technical and technical things that we did in the structure. So the first thing, I just want everybody on the same page. We have 4 schools here in Gardner. We have an elementary school that houses about 1,000 students from pre-K to 4, a middle school with about 550 students from grades 5 to 7. Our high school is grades 8 through 12, and we have a small alternative school of about 60 students. That's a dropout prevention program. Our populations, we have a high needs population of 72.5%. Students with disabilities is about a little bit more than a fifth of our students. Low income is 64.8%, and our English language learner population is 8.9%. each one of those groups has been growing over the past several years. And our race ethnicity breakdown is our white population is 58%, Hispanic population 28.8%, multi-race is non-Hispanic is 7.1%, our African American 4.3%, our Asian population 1.3%. So, the first thing that we always ask ourselves, and what got us down this journey of really having this change, is important. So we always talk about the why before we start talking about the what and the how we did this. So I think it's really important to understand that, this is not like many other organizations where the leader's role is totally unmanageable. So when I think of why I needed to change, I used to go into my elementary schools and my principals would be pulling their hair out of their head, running around. I wouldn't be able to sit down with them for more than 5 minutes without them being called to a classroom and responding to what we call walkie calls. So they're walkie-talkie calls where kids' behaviors were escalated and they needed to respond to that. Every year we would have a goal, and those goals, I've been the superintendent since 2017, but before that I was a principal here in the district. I was 2 years at the alternative school and then 4.5 years at the high school. Each year we would have some goal, attendance, lowering discipline rates, and would work on that goal, would improve it, and then the next year would work on a different goal, and the goal that we worked on the year before would then not really be a focus, and it would go right back to where it was. So we needed to come up with a system of how to use data and how to create a system to respond to data, but not only just respond to it on an annual basis, but make it so once we do something, we maintain those systems and practices and rituals to truly address these issues. And so we consider that what we call adaptive change. Adaptive change and technical change are two very different things. For us, technical changes are creating a system, changing a schedule. Those are things that are simple and don't actually change the behaviors of the people that are dealing with the problem. In order to change the outcomes for students, we really need to change the way we do things. And that's what we consider to be adaptive change. So changing behaviors, as we know, is really hard. I've had these up and down diets where, yes, I'm on a diet kick for a little while, that works for a little while, but then I go right back to my normal eating habits. Those are things that we had to get away from. And then there's just never enough time. When I talk with folks, whether it's my leaders or my teachers, no one has enough time. And we also had frustrated staff and parents. We had students, whose behaviors were escalated, and that was frustrating my staff, my parents, and my administrators. So we really needed to do something about this. And so this is why we needed what we call MTSS and PBIS. MTSS is what's called a multi-tiered system of supports, which I'll go into a little later. And that is our system of how we use data, and we use data to inform our decisions. PBIS is positive behaviors, interventions, and supports. And it's actually a very specific system that we use to address behaviors. Well, at the time, so when we look at it, when we think about our data, we had a high level of student needs that require significant support. This is what we talked about. This is what I was just talking about, where we were responding to classrooms. Classroom behaviors were escalated. We do a universal screener 3 times a year on students' mental health and social emotional state to find out if our curriculum is working, if our supports are working, if we're supporting kids in the way we need to. And those mental health and social emotional issues were very high, and I'll talk about that in a little bit. We had our ODR rate, which is our office discipline referrals. That means the number of times that teachers are calling the office to get support in the classroom because of student behaviors. All of our staff, our administrators, everybody was in firefighting mode. So there'd be a problem, we'd address the problem, and then there'd be another problem, we'd address that problem. but we would never fix or truly address the problem so it doesn't continue at the same rate. We had initiative overload. We were constantly all right, let's do attendance, let's do discipline, and here's how we're going to do this. And we introduce a whole new system that happens for a year. And then when we change the focus for the next year, we changed our system. So we needed to move on from that. Again, disgruntled staff and families. And we had schools that were operating somewhat on their own. When I was a principal, I loved the fact that I was able to do what I wanted to do when what I felt I needed to do. But when I became superintendent, I realized that the principals were all doing what they thought was important. Instead of us deciding together as a team what's important for the district and how do we address it district-wide. So it's a difference for us between having a district of individual schools and having a school district. So when you look at our office discipline referral rates, those lines down below, the red line, is the 75th percentile of nationally of what office discipline referrals are. The green bars are what our discipline referrals were. So it was really clear to us that we needed to address this. So I'm going to walk through this particular story, but please realize we're doing this same process that I'm going to talk about with so many different types of data, whether it's our youth at risk survey data, whether it's our universal screener data, whatever the data is, whatever the issue is, we're looking at all these different factions through a system where we're constantly reviewing this data and responding to the data. So when our theory of action was, if we have strong leaders at every level that focus on equity and have a capacity to develop effective leaders, facilitators, and teams, and have the primary goal of creating a multi-tiered system of support in their school, then Gardner Public Schools will develop a district-wide robust MTSS system that strives to eliminate inequitable outcomes for students and bring about adaptive change to address the myriad of issues that face our schools. So it's important for all students. I want to be really clear. Our assumptions, first off, were all classrooms have students, no matter which classroom you're in, have students with social emotional issues. We have a very large percentage of high need students, and they struggle. And those struggles might be from chronic stress. It might be from food scarcity. It might be from abuse. It might also be from my cat died yesterday, and it's really traumatized me. So we always know that in every classroom, students, there will be students in every classroom that will have either acute or chronic issues that they're dealing with. And if we're going to address this system, we really need to work with the teachers and the staff in the rooms to change their behaviors and to support them more with training and resources to make sure they have what they need to support the students. And it was really important, obviously, that we have equity and access of supports for all students. And MTSS provides us with a system that does all that. It uses data to drive our decisions. It creates that full, robust system where we're looking at all components of the system, making sure that we're giving the supports to the people who need them so they can support our students. So a quick overview of MTSS. This is one of the things we took from the state, and it's actually one of the few things we took from the state. When it comes to MTSS, this was a very helpful visual for us. MTSS has 3 different tiers: Tier 1, Tier 2, Tier 3. Tier 1 means these are supports that all students get. For example, we have a PATHS, PATHS, a PATHS social emotional curriculum. All of our students in grades pre-K through 5 get a PATHS curriculum. 6 through 12 gets Character Strong. That is our social emotional curriculum that all students get. So it doesn't matter what level of need you are, you're receiving that particular service. Tier 2 is when typically around 15% of our students is what our goal is. And those would be students who are identified who have elevated behaviors, elevated issues. They need more social emotional support than just the tier 1. And so that might be a check-in, check-out program where they're checking in with an adult. They set goals for the day, then they check out at the end of the day with that adult. That is one of our simple programs that actually supports about 80% of the students who need it. It's very successful with 80% of the students. But that's one of the ways that we can provide a tier 2 support. Now, students who need tier 2 supports are now receiving tier 1 and tier 2 supports. Tier 3 supports should be no more than 5% of the population, and those students receive individualized supports, whether it's in the classroom or additional supports in the school. Now, when we think of these three, and a student who is receiving tier 3 receives tier 3, tier 2, and tier 1 supports. There are 3 domains that we're always looking at: academic, behavioral, and social emotional. So again, today I'm going to focus on a behavioral issue that we walked through, but this is a sample of what we typically do when we see an issue, no matter what it is, whether it's social, emotional, behavioral, or academic. So when I first started as superintendent in 2017, after a year and a half of being in the schools, we created our structure for MTSS. And so I'm going to start at the core of these concentric circles. Our district strategy team includes the superintendent, the assistant superintendent, my director of pupil personnel services, our English language learner director, and our coordinator for the district MTSS. That strategy team meets every week, although I'm missing today because this was our time to meet, but we meet every week to discuss MTSS and what we need to do to keep it moving forward in each one of the schools. So we talk about year-long PD, we talk about immediate PD that might have to happen for our administrators and schools. We're the ones who drive the process from the background. Outside of that, we have district level teams that are made up of school level folks and district folks. We have an SEL, social emotional learning team. We have an academic team, and we have a PBIS and family engagement team. Each one of those teams meets quarterly. They discuss discuss data, they disaggregate the data, and decide how they're going to respond to the data to get the best outcomes for students. The next level is our building leadership teams. Now, our building leadership teams, we actually pay stipends to 40 teacher leaders throughout the district. And they're on either academic teams, social emotional teams, or the PBIS team. These teams meet on a weekly basis, at least. The academic teams actually meet 3 to 4 times a week. And they actually collect data. They disaggregate the data, they identify issues, and then they bring that information to the building leadership team. So those grade level teams, those academic teams and SEL teams, all those folks bring things to the building level team, which is just the leaders. And the building level team addresses professional development. They identify resources that are needed for the school. They're the ones that drive the process for the school. And the goal is, if we continue the training and we're again using data to inform our moves, that will change everything from our instructional practices, our engagement strategies, the way we our tiered interventions, so each level of intervention and how we respond, and then how we respond to the interventions, which is an academic program. So that whole system and that whole group of people look at this system of what we call instructional improvement. So we identify what's our goal, what's our vision of excellent. This says instruction, but it's excellent anything. What's our vision of excellent support in the classroom? What's our vision of mental health support for traumatized students? We identify what the vision is, and then using these drivers on the outside of this, on the outer part of this circle, we drive our changes to make the vision a reality. So everything from professional development, our resources and materials, using observation and feedback to individual teachers and teams. Our instructional leadership team is actually our BLT, which I mentioned before. And then we have common planning time teams that meet regularly. All of these groups drive the change. And so when we had, so we decided to start with social emotional learning as our first step. So after my first full year of being superintendent, we gathered a lot of information, and the leadership team decided we wanted to focus on social emotional learning because we do believe that students need to be available before they can learn. And by being available, that means, yes, they're in attendance, but they're also ready socially and emotionally to receive information and interact positively with their peers and with their teacher so they can actually learn. If we don't do that in the first place, kids aren't going to learn. So it's important that we created this environment where kids could engage in learning before we actually focused on the curriculum. So academics came second to us. Social emotional supports came first. And so as we're looking at data, we think of data in two ways. We think of summative data, which is in a way like an autopsy, and formative data, which is more of a checkup. Summative data is typically annual data that we look at. It might be, again, or biannual data. The Youth at Risk survey happens every 2 years. Annually, we have MCAS data. We have disciplinary reports. We have attendance reports. All of those things that come out annually are with the kids that we had the previous year. So when we get that information, it's the autopsy because there's nothing we can do with those kids that we had last year because they've moved on and we have a new set of kids. We also use formative data, though, and this is where formative data is data that we can use for the kids in front of us. We change our practices, we change what we do to change the outcomes for the kids who are in front of us right now. So in a way, it's like a doctor's checkup. We see what's going on, we see what the good things are, and we see what the struggles are, and then we figure out, well, how can we change to make it so this student can have a better, more positive experience? And data also is something not just on a piece of paper in an Excel spreadsheet. Data is what you see, hear, and count. So when I said I went to meet with my principals and they could only, my elementary school principal could only meet for 5 or 10 minutes before he was called to a room, that's something I saw. Overhearing staff in the hall who are struggling with a particular student and think that we can't deal with that student, that's data. That's something I can hear. So, and then things that are on a spreadsheet or in a survey are things that I can actually count. And those are the pieces of data that we use all the time. And we believe that data should always be valid and reliable, reviewed by the right people on a specific schedule. It should be easily accessible and understandable, and disaggregated by our subgroups, specifically by our marginalized populations. And when we think of our marginalized populations, we think of specifically students of color, our students with disabilities, and our English language learners. Those groups are our main focus because they've they're not only oftentimes marginalized here in our own system, but they're marginalized throughout the state and throughout the country. So within our system, there's a lot more than just putting a system in place and moving forward and saying, okay, we're just going to do this. There's a lot of coaching that happens that we set up. So again, we have a strategy meeting once a week, and we talk about the progress of MTSS throughout the districts. We also meet and develop short and long range goals for MTSS. We also meet with each principal. Actually, they first have to design a goal related to MTSS that's based on the data that we have. And then we utilize MTSS to implement all initiatives. So ultimately, if you've seen The Mandalorian, we consider that MTSS, this is the way. This is how we do things, and we don't have new initiatives. Everything is about improving how we do MTSS. I attend district meetings and team facilitation meetings sometimes. We also meet with each principal to discuss their teams and what their leadership moves need to be to move their teams in their MTSS process. We have a district coordinator that attends all MTSS meetings to leverages coaching and feedback to move the process for each one of the schools. So just a quick overview of what I'll talk about later on, but after just 2 years, we decreased those office disciplinary referrals significantly. We increased attendance rates, increased fidelity to PBIS and evidence-based practices. One of the things I want to mention about data, when we think of data, we think of fidelity to our practice. So we collect data on how well we're doing the practices that we say we're going to do. And we also look at data that looks at student outcomes. So those are two different types of data that we're constantly looking at. We also increased students on task behavior, improved our mental health ratings on our universal screeners, and we met and exceeded our inclusion goals for students with disabilities. So now I'll get into a little bit more nitty gritty of how we did this. So we knew our first step is to focus on tier 1 because this was happening in every classroom and most teachers in the district were struggling with this. So we wanted to change classroom practices. We know that the teacher is the most important person when it comes to a student's education. So if we change what the teachers are doing in the classroom, we can better support students and have better outcomes for students. So our biggest reason for ODRs, our office discipline referrals, was cutting class. At the elementary school, we call that out of bounds. Basically, it's kids who might be escalated and refusing to go to class. It might be kids who at the high school are skipping class and hanging out in the bathroom. That was our biggest discipline referral. So we really wanted to address what was happening in the classroom so kids would be more likely to go to class and stay in class. This again just shows the office disciplinary referrals overall, which were much higher than the 75th percentile for the country. So our goal was to increase student engagement in the classroom and reduce office discipline referrals by 25%. So we focused on tier 1 implementation, and what I really want to do is talk about what that looks like. So for PBIS, we have to make sure some of the technical things we did was we posted our school-wide expectations. We taught the expectations, so teachers knew them fluently and students knew them fluently. And we created an acknowledgement system to reward and identify and support students who are following expectations. This was step 1, and although this was somewhat technical, the teaching and the fluency were definitely adaptive with this. And we did this because we wanted access specifically for our students with disabilities. When we look at our data, we do have equity gaps for our students of color and our English language learners, sometimes in some areas. Where we found every single time there was an equity gap, it was for our students with disabilities. So again, our theory of action was if we're able to support our students with disabilities, our other marginalized populations would also get the supports that they need. So we have this thing called HLCBS, which is high leverage classroom behavior support. And these are very specific practices that are evidence-based that we want to see in every classroom. So the four areas are right in front of you, and they're instructional activities. So the kids are actually engaged in some kind of instructional activity. That's important. Second thing is that the teacher is proactively monitoring the room. So they're not sitting behind a desk, they're walking around the room, they're interacting with kids, they're keeping the kids engaged actively. Praise to error correction ratio is really the it's exactly what it actually says. It's for the ratio of every time a praise happens rather than an error correction. So praising a student might be, Chelsea, thank you for taking out your notebook. A correction would be, Chelsea, you didn't take out your notebook yet and you need to. What they've found is if you have 8 and this is what the research shows, 8 praise comments to every 1 error correction, the level of engagement in class is going to be about 80%, at least. So it's really important that we give more praise than error corrections. So if I want to correct Chelsea, instead of giving her error correction of saying, hey, Chelsea, you didn't take out your notebook yet, I might say, Tara, thank you very much for taking out your notebook and you're ready for class. So I give her a praise, but that also gives Chelsea a prompt to take out her notebook. So that's actually one of the biggest levers, and it's one of the biggest areas that, and I'll show you in a second, that we needed to correct. And then opportunity to respond is the difference between what I'm doing now, which is I'm a panelist speaking, and you're not able to respond while I'm speaking. This becomes really difficult for little kids. And the younger they are, the harder it is to sit there without actually interacting. So we did a systems approach to this. We came up with an observation tool. We did some professional development about what these high leverage practices are for all teachers. So this was an example of an observation we did of a teacher. And what we did was every 15 seconds, we're looking, were you instructing? Was there a praise? Was there behavior correction? Was there an opportunity to respond? Were you actively supervising? And we check off each one of those. And then we're also looking at what the on task, so what percentage of students were on task at that time. That's using this particular tool. And so we trained our mental health staff to be able to walk into a room and do a very objective observation of a classroom and provide that teacher with feedback on where they were with each one of those high leverage practices. This was really important for us because it's not about the evaluation process and evaluating people out or being harsh with people. It's really about giving them the training and support. So when somebody comes in, it's specific feedback to that individual teacher on how they're doing implementing those high leverage practices. And so this is an example of one of the classrooms. And in gray is how the teacher was on the first observation. We gave the feedback on where they were for instruction, praise, behavior correction, praise to error correction, opportunities, each one of those areas. And then the blue, it was the second observation we did. And as you can see, way to the right, on-task behavior of students went from a little under 60% to 80%, which is the minimum goal of what we're looking for classrooms. You want 80% of the students doing what the specific task is. So the improvement helped this individual teacher. This is another class that had three observations. The gray was the first observation, the middle was the second observation, and the way to the right is the third observation. Now, as you can see, after 2 observations, this teacher's on-task behaviors went to over 80%. This changes teachers' behaviors long-term because they benefit. Having kids only engaged 60% of the time, or 60% of the kids engaged at any one time, makes it a lot harder on the teachers, a lot more frustrating. So when they get that kind of reward, they want to keep doing those same behaviors because they're seeing the outcomes. And so what were the results? Did it work? We actually increased our tier 1 at the middle school. So that means those behaviors of teachers increased 10% across the board for all teachers. At the elementary school, tier 1, tier 2, and tier 3, so they were a little further along, increased 20, 30, and 33%. And the behaviors increased 39% at the high school. So with those behaviors, major discipline referrals at the elementary school decreased by 42%. So the instructional minutes that they gained just at the school, so when you break it down like this, it really is eye-opening. They gained 25.5 instructional days, 9,180 minutes. Administrative minutes gained, so this is time that the administrators would have been typically referring to those, responding to those other calls. They gained 12.75 days. So it clearly has an impact on the level of stress in the school and the level of firefighter mode. It gives people more time, which was one of our primary reasons for trying to make the change. So this is what we call our pyramid. So at the bottom is students only receiving tier 1 supports. The middle, the yellow, is kids receiving tier 2 and tier 1 supports. And the red is tier 3, tier 2, and tier 1. In a perfect world, the very top category would only have 5% or less. The next category would have 15% or less. And the bottom category would have 85% or more. And so when you look at this, it went from 9% in the top all the way down to 2%. They only had 5% in the top 2 categories when that should be in. That's actually excellent even for just the top category. So we reduced the number of kids having office discipline referrals dramatically, having a huge shift in the culture of the school and the feel of the school. And so we actually met our state expectations for compliance for discipline for all subgroups, and we substantially met that goal. That means we went over the goal of what the state expected. And our tier 2 effectiveness was excellent. The students who were making progress was 71%. We had 21% of our students ready to graduate. That means they didn't need the service anymore. And then 7% of the students were not making progress. So clearly our tier 2 effectiveness mattered. And as you can see, we're once again looking at, well, how are our own practices? What's the fidelity to our practice? But then also, what are the student outcomes? And those two are the drivers for how we set up our goals for the next year and how we're responding throughout the year. And in tier 3, 100% of our students were making progress. So this is from our universal screener. And as you can see, from December 2020 to October of 2021, we went from only 57% in the normal range to 71.5% in the normal range. So our supports were definitely having a positive impact. Extreme risk went down. Again, this is by our universal screener that we do 3 times a year. Instructional minutes gained district-wide was 355,000, over 355,000 minutes gained throughout the district. Estimated, obviously. Our DIP is our district improvement plan. Special education referrals were reduced 10%. We exceeded our goal that we had set for ourselves by more than 47%. So as you can see, you know, when you're looking at how this went in 2019 and 20 and 2020, 21, 22, it's significantly reduced to what it used to be. And full inclusion. So this is a big thing for us. We have what we call least restrictive environment, which means that we want our students with disabilities in the least restrictive environment. So they're more likely to engage with their peers. They're more likely to have access to grade level instruction if they're in full inclusion. That means they're in with their peers. They're not in a separate room. And our inclusion rate was 73.4%, which again was 13 percentage points higher than before. And we're still growing strong. So those were just, you know, right after the implementation. But to be clear, when we're looking at our building and GES, our elementary school, where our on-task behaviors are now at 85%. Our elementary school had a 38% increase in student engagement, a 29% increase in student engagement at the high school. The middle school was pretty much the same. A risk ratio is the likelihood of a specific population. If everybody was at 1, that means everyone is at the same level for their population of folks for office discipline referrals or anything else. So our African-American, our Black students had an 84% decrease in office discipline referrals, a 48% decrease in for our Asian population, 36% decrease for our Hispanic population, and a 13% decrease for our multiracial population. So huge wins across the board, but again, specifically for our some of our marginalized groups. Chronic absenteeism, we had a 14.7% decrease in absenteeism for students with disabilities, and we're closing the gap between Gardner and the state average. Our dropout rate, risk ratios, again, we had no difference for dropout rates, no significant differences for equity gaps. So an equity gap difference would be for the state 2.5%. Ours is more than 1.5 times the rate. Students with disability dropout rate decreased drastically, and even our teacher retention rates increased, and we were above the state. And again, our fidelity. This is our fidelity to our practices. How is it going now? These are a percentage of improvements overall. And then these were our absenteeism rates, chronic absenteeism versus the state accountability targets. And as you can see, we either met or exceeded most of our targets. Historically, if you start to look at our suspension rates for our marginalized groups, all the way there to the right. By the way, I didn't do 21, 22, and 23, just because those years with COVID were a little strange. So the last year I did was 23. So just looking from 2019 to 2023, you can see we're radically different than we were just a few years ago. And having a tight grouping means that we're not having disparate outcomes for our marginalized groups. And this was something I wanted to put in the slide. We just had a comprehensive review. DESE has a team that comes through every 6 years and reviews our schools on either the classroom culture and on academics. And when you look at our classroom culture, this is on a scale of 1 to 7, not 1 to 10, 1 to 7. And negative climate, by the way, is a reverse score, so that's a positive thing. The higher it is, the better the score. As you can see, we had 3 scores that were above 6, and 2 that were above 5, for classroom culture. So clearly, the culture of the school is becoming more positive as well, and that's by a third-party group that came through, a consulting group that came through and looked at what we do. So we have a lot of outcomes, and that was one issue that we addressed. But again, we addressed, a myriad of issues, whether it's attendance, discipline, mental health issues, supports in the classroom, and academics. All of those things are things that we do. How close am I to time? Was I? Okay.
You're doing great.
So thank you. And I don't know if there are questions.
I think what we're going to do is try and take questions in the chat and address them as we go. And Mark, I don't know if you were planning on staying for questions as a panelist. We're going to take about 15 minutes right now and go through so what we have for tools for schools to use. So I'm just going to say, Mark, thank you so much, because one of the 2 things that jumped out at me the most in your presentation, not being a person who's ever worked in a school, were the data supporting the change, right? Because it's hard to change. It always feels like it's going to be just more work. The data supporting that increase in buy-in from teachers, but also from community, where you really were able to show over time and are continuing to be able to show over time the impact of these programs. And the other thing that jumped out at me was that all-in holistic approach, not clinging to the wall, just like jumping right in that pool, because of that. I think it's definitely, the instinct, right, is to do like one thing at a time, and to try and to layer things in, and to really take it as a we gotta do all of it or none of it works approach. So what we did was we were hearing a lot about resistance to collecting data from various schools for all kinds of reasons. From like, this is going to affect house values in our town. We don't want to call anybody out. We don't have the tools to do what to respond to data. So if we collect data, what do we do with it? And so we have tried to both encourage the positive norming of using data to celebrate the positives and to celebrate your progress, but also what is the response, right? When data comes up that says we need to do something different. So we collected a lot of information about various curricula that are evidence-informed and aligned them with the new DESE health standards to say, okay, so which pieces work for which grade levels, and it's available on our website, and we're going to walk you through it in just a moment. But I'm going to let Olin, who's at Luck, talk a little bit about the student surveys, specifically the YRBS and Luck's role in implementing that.
Yeah, thank you so much, Mark, again. And I'm just going to jump right into kind of talking about what Luck can offer in terms of assisting schools in collecting some youth data. So we focus on the Youth Risk Behavior Survey, which is a national survey that's conducted typically about every 2 years to monitor youth health behaviors. It focuses on grades 9 through 12, and it covers a number of behaviors that can lead to social problems. There are questions about mental health, suicidal thoughts and behaviors, social media use, substance use, and the data is then used to develop programs and policies to improve the health of young people. And as kind of facilitators of the survey, we market the survey as the Youth Community Survey. We found that it makes it a little bit more approachable for schools and for young people, rather than kind of addressing it as a risk behavior survey that can be kind of intimidating for some young people. So we've done a little rebrand on our end. And we also offer assistance in facilitating 2 different versions of the survey. The national survey is pretty long and substantial, and we really understand that some schools don't have the capacity to deliver a survey like that. So we do offer a shorter version that omits some questions and a little bit of information just on kind of how the survey is implemented in general. It's a completely anonymous survey that is administered online, and all of the data is stored in a secure way, and the data is only ever shared at the discretion of individual schools. So kind of your data is your data, and you get to do with it what you would like. Thinking about what that data can be used for, we kind of just saw some amazing examples from Mark of the power of collecting data over time and looking at trends over time and using that to inform what we as school staff are doing to support the well-being of our young people. So more specifically, with individual school data, schools can look at prevention and intervention efforts to kind of target where they are seeing the most impact for their students. And then additionally, for groups like GCAT and the North Central Community Action Team and Chana 9, we are able to compile individual school data into a regional data set that then allows us to do things like this to support regional efforts to improve the health and safety of our young people. Thinking a little bit about kind of luck and how we can assist schools in implementing this. Currently, luck can offer youth community survey facilitation for free. Depending on future funding, there may be costs associated with this in the future, but I want to give you a little picture of kind of what it takes to implement it and what luck offers to support that implementation. So if in collaborating with luck to implement this survey, we provide the survey digitally to schools, and we offer it through a secure digital survey service. So everything is school specific and very secure. Again, we offer shorter and longer versions of the survey. And so essentially we collaborate with schools to coordinate a date to implement the survey. In the kind of regional effort, we try and schedule those times close to one another across the region so that we can then kind of faithfully compile all of that into a regional set. We provide scripts for the teachers to read prior to survey delivery. This really helps the young people kind of understand what they are participating in. It really assists in their understanding of the anonymity of the survey. And I would say particularly in a school setting, we like to make it really clear that this doesn't impact their grades at all. And following the implementation of the survey, we compile and quantify data for the individual schools. And then we do offer kind of consultation presentation of your data. Of course, the data is yours and we allow you all to kind of interpret it as you wish, but as people that kind of have experience with prevention and intervention efforts, we love to kind of talk through the data with schools and talk about what they're seeing, what we're seeing, and how we can then think about what prevention and intervention efforts would be effective for schools. And that's about it. We really do love kind of working with schools and facilitating this. Most schools end up implementing the survey during a homeroom class period. So even with the longer survey, it can still be completed in that homeroom time. Yeah, so that's just really a little bit about what the youth community survey / youth risk behavior survey looks like through our end, and how we can support you all as school staff in getting that into your schools.
Olin, there's a question submitted for you. Does the YRBS survey address bullying?
I believe the long version of the YRBS does have questions about bullying. I have a really hard time remembering what the long version and short versions have versus don't have, but I am pretty confident in saying that the long version does have questions about bullying. Yes, thank you, Veronica, you're the best.
And Mark, there was a question for you. Do your schools use relationships outside of school to support your students? I assume that means relationships with community-based organizations.
Yes, absolutely. We actually have outside counselors who come in. We have, everything from, we look at coaches to other partners when it comes to supporting our kids. So yes, we do those things, most definitely. And there's definitely bullying information that we use every time that comes through. So that's kind of one of our key indicators, by the way, on the youth survey. So
Yes. And I'm going to ask you one more question, Mark, and then I've got one more question for Olin. Mark, could you share feedback for school administrators that may have concerns youth will provide off or skewed or inaccurate answers when when completing youth surveys?
we haven't really found that. We've found actually that it helps address the social norming of a lot of the behaviors. So we haven't found that kids are doing that. I'm sure there's some of that happening, to an extent, but I don't think there's that's actually happening to a large extent. So the data to me seems like it's pretty solid. So we've used the data a lot. Vaping was, one of the things we used it for. We used it for taking pills. People think everybody's doing it, but when people are reporting about themselves, they're usually pretty honest.
And because the survey is anonymous and administered online, that probably creates a little bit more integrity when students don't feel like anybody else is seeing it. They're not, sharing information that that anybody else is going to see. So really, why skew it?
One of the things we try to teach is not to trust the computer so much, but I think in this way we're at an advantage, quite frankly. So
right.
Yeah, but because they trust that it is anonymous. Yeah.
Yeah, going off of that too, I think that a lot of kind of what you say as you're starting the delivery of the survey, I know that that's something that we are very intentional with about the scripts that we provide to schools, is kind of maximizing the language that we use in order to then maximize truthful responses from our young people.
And we have one more question. Actually, this one, Olin, is to you. How does the YRBS survey differ from other youth surveys used in school districts?
That is a really good question. I am only really familiar with Panorama. The youth community survey that Luck administers is based on the national survey. So the majority of the questions and language that we use for that come from the CDC Youth Risk Behavior Survey. I unfortunately am not super familiar with other surveys. I don't know if there's anyone else in the room that has a little bit more familiarity though.
I think, well, I'll just tag on to that and say that the advantage to doing the YRBS is that regional data set, right? The ability to track change over a region, which kind of takes a little bit of the individual focus and pressure off of each school district as they're collecting their own data, and they can kind of have that to themselves, but then they can compare that to a regional set. Whereas if everyone is using a different survey tool, and depending on whether it was something that they developed themselves or whether it was something that that they got somewhere else, how supported is it? How, what's the longevity of that? There's definitely schools that are going to be resistant to converting to like YRBS if they've been using Panorama or some in-house system for long enough that they have data collected over time. And so their year over year is what's important to them. So I don't think that there's like a wrong answer to that. But I think those are the major differences, is that, when a school is using something that works for them, they want to be able to use that data over time. It is really hard to switch from system to system, survey to survey, year over year, because you really do kind of lose that ability to compare your year over year progress. I am going to, I don't see any further questions in the chat at the moment. So what I'm going to do right now is switch over. Mark, would you mind putting your contact information in the chat? That was the last request that I see posted. What I'm going to do now is share that where you can access that school health curriculum toolkit that we started talking about. Okay, let's see. Okay, can everyone see that?
Yeah.
Okay, great. Okay, so this is our website, chennai9.org. And if you go over here to our tools and resources page, there's a section called Mental Health, Diversity, Equity, Inclusion, and Belonging Resources. Right at the top there is a link to our school health curriculum toolkit. And I'm going to apologize right now because at the moment, it is not terribly pretty, but it is highly functional. So what we are going to do, in fact, we literally just hired someone to do this. We hired a communications associate. We haven't even finished the paperwork for the person yet, but they are going to be putting this into a more user-friendly, this is very usable, but it is not pretty to look at right now. They're going to be putting this into a better format for us. But there are, as you can see, many health curricula that are all linked here. So right across the top here are multiple curricula that address different age groups. They address different skills and different topic areas within health. So some of them are more nutrition and physical health related. Some of them are specific to substance abuse. So there is a column, a row here that asks what it covers. Is it comprehensive? So we talk about what topic areas it covers, what grade areas they cover. There are other information. There's a quick overview. So if you don't want to go directly to the link, there's like a 1-sentence summary of what the program is. We have tried to, okay, so this, which is, again, this is ugly right now, but I promise it'll be prettier when somebody who's not me does it. But what this does is check off which of the DESE health curriculum standards, and those are the new ones that were just updated this year, which of these this particular each curriculum aligns with. So if it's checked off, it does align with these. It tells you what grade level it aligns with. We are hoping that this really kind of helps people to find the specific tools that will help them. It talks about whether it's culturally and linguistically responsive, what the intended outcomes of the program are. I do want to note that it does say also whether it is evaluation and outcome based, evidence based. There's some different language that gets used around how programs are evaluated, and we didn't want to only have things that were considered strictly evidence-based, because that can be very restrictive. It eliminates a lot of evidence-informed, really wonderful programs. So we wanted to kind of give everybody the full gamut of what's out there, but also allow them to understand what evaluation methods were used for each program. Olin, do you want to talk a little bit about Olin did a lot of work developing this, so I want to give her the opportunity to, I just want to also point out we have current use. So if you're wondering more about a program than just what it says on their pretty website, you can actually look here to see who else is using this particular program. If anybody local is using these programs, it's noted. And the reason we tried to put this in this format, in an online format, is that we can continually update it. So rather than having a PDF that goes out to everybody that's instantly outdated, these are live links to all of the programs. So as they update their programs, that will be updated as new partners or school districts, as we become aware of who's using them, we can add that right in here as well. Olin, do you want to say any more about?
Yeah, I mean, I think you covered it pretty well. There's kind of a lot of information there, because there are so many curricula out there. It's kind of daunting to even start thinking about looking at finding a curricula that will best fit the needs of your students and your school. So we've tried to break it down into topics and areas that we know schools would be looking at. So we have kind of just general overarching themes and content things. We also have information about time or like implementation time and cost in there. And yeah, honestly, it was a lot of fun to work through, looking through all of the curricula and finding ones that kind of really highlighted what DESE is communicating to our schools about the importance of school health and wellness curricula and how best to support our young people. But I think overall, the kind of concept is what Chelsea mentioned, that It's a resource for schools to kind of try and take some of the pressure off of doing all of this research and finding the ones that best fit the needs of their schools. And I would say the kind of topic feature and looking through those topics is one of the most valuable things. If you know about needs for support in your young people, it's a really good resource to see which curricula best support those needs.
And I did have a request to make it larger, which I don't know if that helped at all, but it does. I will say that while this is not pretty right now, being able to kind of quickly go through a chart or scroll through and figure out, I'm really only interested in elementary age programs right now. I need it to be virtual. You kind of can figure out, okay, you've got, these are the 4 programs that I want to actually click on and look through. So hopefully it gives you sort of an easy way to start your research rather than, Google or kind of trying to find each one of these individually. It gives you sort of a one-stop place to start your research. I'm going to stop sharing and take any questions. Actually, before I stop sharing, does anybody have questions about the toolkit? And I can guide you to like a specific area of the toolkit. And again, apologize. We are really planning to make this something that you can access more easily in the website. But if you are going into this now, you will encounter this spreadsheet, and it is much easier to navigate when you're the one driving. I'm looking, let me go back to my screen to see if I can't see anything other than the Q&A. So if there's anything in the chat, I don't see it. Chat. Okay, sorry.
You're good. I'm also looking at the chat. So
okay. All right. So I think what we're going to do now, I guess the last thing that we should mention is that we are available, both Olin and I, for technical support around this, this toolkit. So if there are resources that you encounter that aren't on here that you think are amazing and should be included, absolutely let us know. If you are using one of these curricula now and you're not listed as a school district that is using one of these, also let us know, because that gives other people the opportunity to contact your school and say, hey, is this amazing? Is this worth our time? Should we do it? If you have any feedback about any of what's in here, like I said, the benefit of doing it this way is that it's live and that we can always update it and make changes to it. So Olin and I are happy to take new information to help us keep this updated and as useful as possible to everyone. Okay. We are going to move now to our panel discussion because a lot of these programs are implemented by outside providers, by partners who are community-based. A lot of what happens in a lot of the hurdles in terms of bringing programs into schools is maybe I don't have an in-house person who's an expert in this. So now we have to do all kinds of training before we can even add to the workload of someone who already has a full load. And so these partnerships with community-based organizations that deliver these educational programs in a really professional, accessible way are really important. So I'm going to introduce our panel, And I'm gonna start by having each of our panelists just, if your organization, I'm going to start with the ones who are those outside organizational partners, community-based organizations. If your organization delivers in-school or prevention curricula, I would like you to just describe the program or programs that you that you implement, what the target focus or purpose of those are, kind of the basic mechanics of how that program's delivered, whether, you know, in terms of how long it takes, is it flexible, can it be broken up into multiple modules, are there staff materials, costs associated, any other logistical considerations, and the impact or outcomes that you've seen when you've brought these programs into schools. I'm gonna start with whichever panelist wants to go first. So feel free to unmute yourself and just introduce yourself.
I'll jump in be first. So I'm Christy Cutting. I'm the Director of School-Based Teleservices through Haywood Healthcare. So we're actually within 5 different districts. So we provide school-based programs offering support with mental health treatment, medical needs, substance use prevention, youth mentoring, and community resource assistance. So that's a lot of information, a lot of programs. So they're basically breaking down the staff. We have 2 school-based health centers in 2 different districts, which each of those has a nurse practitioner involved with them. Off of the school-based health centers, we have 7 telemedicine carts located in other schools. So again, we're meeting our medical needs with our students right at school as much as possible to keep them within the buildings, and also to help support our families so they're not pulling their child out of school and sitting in the emergency room or urgent care for a few hours. We're trying to meet them at school and provide those services as much as possible. So that's our medical piece, as well as we provide the mental health piece. So we have 10 clinicians. 8 of those clinicians are via tele. 2 of those clinicians are in person. The 2 in-person clinicians are based within our school-based health centers. We also have 8.5 school-based community health workers. So those community health workers are based within the schools full-time. And so they become really part of the school community. Even though they work for us, it's really as if they're part of the school and not really part of the hospital itself. And then we have 3 Project AMP mentors who are working, who are split between 2 school sites for each of them. So they're providing mentoring services within our schools sites as well. So it's a broad range of assistance, providing a large amount of meeting everyone where they're at, bringing the services as much into the school as possible, and assisting our schools also with the community resources they need as well. So, did I answer all your questions, Chelsea? I think I did.
You did. You did. There'll be follow-up. So if you didn't, we'll get whatever else there is. Veronica, do you want to go next?
Yeah, I will. Good morning, everyone. Veronica Patty. I am the prevention coordinator for the city of Gardner, but I work with surrounding cities and towns as well. And I coordinate the Gardner Community Action Team, which is a prevention-focused coalition here in Gardner and surrounding areas. So a few of the curriculums that Chelsea asked me to speak about today that we've been implementing for a few years now is the program called Game Changers. That is a resiliency building curriculum. This was a few years back. I saw a presentation from folks at 49 North, and they do a lot of resiliency and self-work workshops and trainings. They created one for the military, and it was really intriguing. It was very interesting to me. So we reached out to them and said, oh, this is wonderful, but it's a very intensive program to do it in the military. Because they have them for 3 months straight, and and we knew right off the bat that this is no way to implement it in school, but we really like the benefits of building resiliency and coping with stress, and so we came to them and said, hey, would it be any way to kind of adjust it to school setting so we can fit it into school and have students do this program? So we did a little bit of work. They were able to cut it down to 6-hour curriculum for us. Focusing on strengths, values, and relationships. Those are the 3 topics that we cover in this workshop or training. What is really wonderful about this program is that it's all self-work. It's really the person, which is me, and we have a few other facilitators that were trained that can come do and facilitate this in your school. Are really just facilitating. This is, they have a workbook, they do their work. We do talk about stuff, but a lot of it is their own personal work. And they tend to really like it because it's all about them. And if they don't want to share, they can write it down and no one has to see. So there's a really, variety of way how to get them thinking about kind of a bigger things, maybe things that they don't think about or they haven't had a chance to think about in school setting. Anything else about it? What did I say? Oh, so what I've done, I've implemented this mostly in the health classes. It can be broken down to, obviously 6 hours all at once is not gonna happen. So we can break it down to 1-hour sessions, 2-hour sessions, whichever way it works. But in the health classes, it's been the most, feasible to do, and it works great with I work with Gardner High School, and it works great for them fitting it into what they're already teaching. So it's kind of supplemental to what they already do in a class, and it works great. The second training or workshop is a TAB training. It's called Training Active Bystander, which is it's a program or a training or workshop that helps them, not only the students, this is for ages 12 and up, help analyze potential harmful situation. And then it goes into kind of determine what are some of the inhibitors and what are some of the promoters, what are the things that stop us from becoming an active bystander, what are some of the things that want to encourage us to do so, and how to kind of sort it out within ourselves. So when students come across a situation, how to kind of determine, I can deal with this myself, I'm brave enough to step in and do something about it, or I need to go get help, I need to get an adult, I need to get friends to deal with the situation. So again, it's a very much all about the students. They get to do most of the talking. It's that class, it's a little bit, and Chelsea teaches it too, so she can speak on that, but that class is it's a little bit different every time because the things that the students and the people want to talk about, it's a little bit different every time. But it always leads to how to identify harm or harmful situations and kind of how to act in that situation and encourage them to be brave and have some courage to speak up on behalf of others and themselves. So that one is a 2.5-hour curriculum. It can also be broken down. We have done it in 2 hours in schools because that sometimes seemed to work. So we've squeezed it in if we needed to. And I have done this training in Ashburnham and Westminster, in Gardner, and also both of these trainings were done at a college as well, at a college level with the high school age students at a college. And then I don't know if you wanted me to talk about the vaping prevention. I don't know if this is a good fit, but this one is the interactive activity that we do. It's called Escape the Vape.
Veronica, can I jump in on the tab first?
Yeah.
And then go to that, yes. I wanted to just mention that we have actually trained a hub of youth to deliver TAB in their own high schools, and they can deliver it to other youth groups. One has taken it so far that he has worked with the creators of the program to develop a elementary school specific version of the active bystander training to really change the language and the activities to be more accessible to even younger kids. But the youth hub is really meant for older high school youth to be able to train middle school youth in their own kind of at their own level, in their own setting and their own language, and that these youth leaders are really looked up to by the students. And yeah, so everything else that Veronica said, it's free to schools. It is coordinated through us, through either Veronica or myself, and we can help schools implement that program. And it is highly interactive. The students are up and moving, and speaking and working in small groups. And really engaging through the whole process. And it really, they don't come out experts in how to be an active bystander, but they come out with some new ways of thinking about situations and some new ways of accessing different types of tools that are custom to them, right? To their own strengths and abilities and comfort levels and situations. Okay, go ahead, Veronica.
This is what teamwork looks like. Thank you, Chelsea, for yes, absolutely. Our youth are a big part of that. That was a big addition last summer. And then, so the last one I started speaking about it's called Escape the Vape. It's about 30 to 45 minute activity I've done this in the middle school. And it's a escape room type of activity. They get to solve puzzles, but it's all around vaping education, and that's been pretty popular as well. So I've done those in Gardner, in Ashburnham, Westminster, few others maybe, a few years back. These are recent. So anyway, so I think that's all I have. And as Chelsea was saying, these are all free and being implemented by outside people coming into the school. So no really pressure on the school to be training people in curriculum. We do have trainers and facilitators that can come in and do this.
Thanks, Veronica. I'm going to go to Tara Heward now from the YWCA.
Before we jump off of you two, just from the chat, who would be the best contact if somebody is hoping to have a TAB training facilitated by one of our youth facilitators?
Either Veronica or myself can connect them with the right youth. We have youth in 7 different school districts, but we also implement the training, and the instructors in our region occasionally do additional train the trainers for, so if there's youth in your school who really want to become a trainer and they're not already a trainer, we can connect them with Quabbin Mediation, who does instructor training. Okay, Tara, you're up.
Good morning, everyone. My name is Tara Heward. I'm the Director of Domestic Violence Services for the YWCA. We have several different programming that we do offer in schools. The tricky thing with some of them I'm gonna mention is they are grant-based. So one in particular is Girls Promoting Safety. That we have in all of the middle schools in Worcester County through a grant through the Women's Initiative. It is a great program that is evidence-based. The curriculum runs through the entire school year. And the girls are working on everything from financial literacy to healthy relationships that include friendships, parent relationships, teacher relationships, dating relationships. I mean, everything you can think of is in this curriculum. It really is a great program. I'm sure if people in the North Central area were interested, there probably could be grant opportunities to get it in that area as well. Something we're always looking for. In North Central and in Worcester, we have the Girls' Choice Program. This is for middle school and high school girls. Also an evidence-based curriculum that also covers everything that I just mentioned for the Girls Promoting Safety program. One of the things I love about the Girls Choice program is they also have opportunities to fundraise, to create trips to go visit different colleges. So I know recently the girls were able to go visit a college down in Florida with their facilitators with funding that they raised. So the facilitators do help the high school girls go and visit different colleges throughout the area, depending on how many, like which college, it could be a bus of them going, it could be one facilitator with one youth going. They always have a great party at the end to wrap up the little community that they have created. And I know there are successes of girls furthering their relationships that they founded with each other in these groups. My department specifically, we do healthy relationship workshops. We kind of have taken some of curriculums we've used in the past that are outdated. Those would be Teens Act and STAR. And we've taken that information and then a lot of other information that we have found, and we always are paying attention to trends that are going on, and we've created our own curriculum. So this makes it great for us because we can tailor it to the needs of different schools, because some schools have a little bit different things happening in regards to dating and relationships, but we all know there's issues happening. And on top of that, Mark, one thing you said that was great is these kids are coming to school and we don't know what kind of trauma they're experiencing. It could be a cat. It could be they're experiencing their own abuse by a parent or a caregiver, but the majority of them, I can guarantee you, are experiencing some form of intimate partner violence in their homes. The numbers are astronomical in regards to the number of children who are witnessing domestic violence. So where we do not necessarily provide counseling for children, we do have opportunities to create groups around healthy relationships for children so that they don't continue that cycle into their own lives. Because what they're learning at home is not necessarily what we want them learning what a relationship is. So a few years back, which has probably been more than a few, I've been here for 10 years. One of my favorite groups was at a Fitchburg high school that I ran. And I did both a boys and a girls healthy relationship group. And I was able to bring them together in different times where they were able to share some of what they were talking about in their groups. And it really was such a great group, great feedback from them all. And we would talk about everything from self-esteem, to dating relationships, to friendships. Friendships was a really big one, all of which that are going to come into play for how you're responding in any type of relationship, right? If your self-esteem isn't quite there, something could be off. So how do we help support you there? Communication was also another big one that we add into most of our programming in our curriculum. We have noticed through the years that communication is one thing that you struggle with, especially healthy communication. We tend to see either a lot of passive aggressive, or aggressive. And when we were doing some of these programmings, we noticed youth really didn't understand the differences in some of those. And the majority of them did not understand assertive. So that is a skill set that we have worked into our curriculum. And the times or the length can vary because, again, we're tailoring it to the needs. We've gone in and we've done a week in classrooms. We've done them in health classes. We've done them in psychology classes at the high school level. We've done them, I did them in an English class, which I loved that they brought us in. And we would sit for a week and we'd make sure we connect with each and every class that's coming into, let's say, that English class. So we're connecting with each group. And we're covering several different topics during that week. And then at the end, they do a post-survey. At the beginning, obviously, they're doing a pre-survey. And we're able to see, was there any level of increased knowledge in regards to the topics that we're discussing? And we've always seen that, yes, there is. And youth have asked for us to come back, which I will take that as a gold star because they're enjoying the programs. We've also done them after school. We've done one-off full day workshops. If it's a special event or something, assemblies. We are funded by DPH for providing this programming, so there is no cost associated with those. And I think I covered everything, Chelsea, right?
You did. And I just think it's so important for schools to know that there are these experts who can deliver these programs and that you can deliver them in an English class, right? You don't have to have the expert in the room to in the school. And I just think that that's so helpful and useful. And also to know that you can work with schools about what their time looks like, and what their specific needs are, that you're not just going to come in and deliver like this is the packaged program. So I think that that's super helpful and useful to just, see a face, be able to connect with a person, and know that you can work with that person on a program. So, excuse
Chelsea,
me, thank you.
one other thing I want to mention, outside of necessarily working directly with the youth, or coming in to provide programming, is we do always act as consults. So I connect with a lot of social workers, a lot of adjustment counselors, guidance counselors, where if there's issues happening in the school that they're noticing some intimate partner relationships that aren't going so well, they can always reach out to us and we can do a consultation around safety planning. If there's restraining orders, we can definitely give guidance on how to go about those. We are in all of the courts in North Central, so we can also assist parents if they are supporting their youth and getting a restraining order. So I'm happy to put my contact information in the chat as well, if anybody needs support.
Thank you, Tara. That's also really good to know. I think kind of anybody who interacts with youth or patients or a service population, kind of their worst nightmare is somebody coming to them with an issue that they have no resources or, their own ability to deal with. So knowing where to turn to get people the right services is, I think, really empowering for people to feel like they can help people effectively. I am going to come to the mock team now. So there's, I think, 3 folks from mock: Michelle, Ron, and Rose, if you want to introduce yourselves.
Hi, everyone. My name is Rose. I work for mock. So mock stands for Making Opportunities Count. And we are located in Fitchburg. We have a lot of different locations. I'm here on the ACE team. ACE stands for Adolescent Sexuality Education. So we're in a lot of the surrounding districts teaching a sexual health curriculum. I'll let Michelle introduce herself and then I can go a little bit more into the questions.
Okay, and my name is Michelle Maiola. Thank you so much for inviting us to join today. I apologize for my background, my lack of makeup. I'm getting ready to leave on vacation after the summit today. So I just want to thank you again for thinking of us. And I am a nurse practitioner. I work with Making Opportunity Counts Reproductive Health Services. And myself, Ron Gallant, who is also on this call, happens to be our community health worker. Our reproductive health services is a new program within Making Opportunity Count. We are a health clinic that focuses on sexual reproductive health for people of all genders, all ages, all sexual identities. Everybody and anybody is welcome. Can discuss PrEP, birth control, sexual, testing for sexually transmitted infections, definitely full scope classic gynecologic care. But we are one of the many, many, many programs that are available within mock. And maybe Ron, if you want to come off, I don't know if you can speak, introduce yourself, and maybe go through some of the other programs that we have within mock that might help benefit the summit.
If Ron's not able to come off mute, I can also go over those programs.
You should be able to, but you might not be ready to. So Rose, if you want to jump in for the sake of time, go for it.
Okay, I can start with the paneling questions and just with what we have to offer. So this is our 3rd year on the ACE team being in the Gardner district. I myself have been at mock for 8 years. Our program has been around for a very long time. We are also funded by DPH. So we come into the schools and we deliver sexual health curricula to the students. We are currently in Gardner District, Narragansett District, Oakmont, Fitchburg, Leominster. We're in the Gardner Alternative as well as the high school. Some districts we are in middle schools and high schools. We focus right now mostly on high school. We offer, right now we're using Making Proud Choices as well as 3 R's, rights, respect, and responsibility within the high school. So what it looks like right now is we work very close with the health teachers. We come in with our curricula and they choose what they would like. We have what we call mini sessions as well as full curricula sessions. The full curriculum sessions when we come in look like we see the students 12 different times. That can look very different. It can look like once a week for teachers. It could look like twice a week for teachers. And we complete a 12-week series with the kids. It goes over topics like communication, healthy relationships, decision-making, STIs, birth control, LGBTQ. Those are just to name a few within the 12 sessions. Some of the schools, for instance, I'll use the Gardner Alternative as an example. Their schedule is a bit different, so we do mini sessions in there. We see them about 3 to 5 times and give them the topics they feel most necessary that the students may need. And that can change from year to year as well, depending on the student's needs. Mock all around has over, I want to say, I think 32 different programs at the moment. So when we come in for our curriculum, we also will give out lots of resources for all these programming. Michelle just mentioned the new clinic, but we also have behavioral health and many other different parts of mock that might help the students within the school system. And we're always working with the guidance counselors as well as the nurses to make sure the youth have the services they might need. This I also left out. It is free of cost since we're funded by DPH. It is not at no cost of the school. We connect usually first through telephone or email, set up some meetings with the school districts, and have the conversation on what might be best for the schools.
Chelsea, how can we get more information on how to get all or many additional programs within mock involved in the schools and everything to maybe help behavioral health or the counseling center become more involved in the surrounding school systems? We are very much open to having students come as patients to see us in the reproductive health services. We also have the Family Resource Center. Again, we have a lot of resources, much like it sounds like what Tara was discussing from the YWCA. We also at Mock have a lot of different programs that might be very beneficial to all the different school communities.
So I think, Michelle, that's a great question. And as Rose was talking, I was thinking that this all kind of really does rely on schools knowing who to contact, right? And that they want to invite this into their, there is some outreach that's done by the organizations to school districts, but really the most effective way for a school to get those kinds of programs in is for somebody who's the champion at that school to contact these organizations and invite them in. But what we are trying to do with this summit and in general is to be able to kind of collect that information now, that contact information, and give that out to the schools for them to use. So if you want to put your information in the chat,
okay.
And if there's any links to specific programs that you'd like to put in there as well. If you have things like handouts or flyers that are in more of like a PDF form that you want to email to us, we can send those out along with the recording.
That'll be perfect. Thank you.
Okay, and I noticed that Ron is now on camera, so I think you're able to speak.
So hello, my name is Ron Gallant. I do work in the reproductive health services here at Making Opportunity Count, but I also work a lot with the ACE team. So I'm kind of the in-between between Michelle and Rose, kind of. So I just started last fall, so I kind of saw the tail end of going into schools with the ACE team, but I basically just go in to kind of introduce the clinic to them. And, as, whatever they're kind of teaching, relay that to the students. Well, if you have questions on, the STIs, the gynecological needs, but yeah, that's where we are and where to find us. And I get to see you guys out at the events.
Yes, we do. Everybody does a lot of outreach at these at tabling events, community health fairs. So that's another great place for school-based personnel or other folks who are interested. And it doesn't have to be a school-based person. It can be, a parent who, first interacts with these programs and connects them to the schools. Really, again, all it takes is a champion. And I'm gonna come now to Pathways.
Good morning, everyone. My name is Bailina Cruz. I am from Pathways for Change. We are the sexual assault youth education program. So we have, for the schools, we have the MAC and SAY program, and the role of sexual assault youth education and the Male Advocating for Change program is to raise awareness of the incident and myth about sexual assault that have a role in the building and expanding resiliency factors and strengths of adolescent community. Some of the topics are healthy relationship, the type of abuse, gender-based violence, consent, social media safety, anti-bullying, self-care, and coping skills. We provide services to middle school, high schools, even some college students. We serve all Central Massachusetts and South Central too. And our program is that we go to the schools, provide sessions. It could be to 1 to 7 sessions, depending on the teacher. We also change the language, depending on the classroom, if it's middle school, if it's high school, if it's college. So we change the language. We see what the kids need. So we talk to the teacher first. So they will say, oh, I don't want you to talk about consent yet, but talk about healthy relationship. Or we talk to the teachers first to see what's better for the classroom. Usually we do it in health classes or the auditorium. Sometimes we do it in a big setting. So that's what we do for the education part in our program.
Thank you so much. And I've just been copying people's contact information for their programs. If you could add, if you haven't done it, your contact information and your organization and the program names
Yes.
with your contact
So,
information.
and then we have the Male Advocating for Change, and that's specific for the boys and males. So that program is very good because it's advertising for only boys, and they talk about healthy masculinity and all those things.
Thank you. Super important. There are not enough of those programs, so good to know. Thank you, Michelle, for putting that in. Did I miss anyone as a panelist before I get to my first question for panelists, other than the introduce yourself and your programs?
My name's Amy Pearson. I'm actually here. I apologize. I got into a wasp's nest yesterday, so I'm a little embarrassed to be on the camera right now. But I did want to say that we have 3 school-based programs in Monty Memorial Middle School, and then down in Webster Middle School, and those are funded by DPH, and those really are all designed to address social, emotional issues, prevention, substance use, bullying, anything, academic support, decreasing the amount of risky behaviors in adolescents and youth. And those programs are specific to those actual schools. So you have to be a student in those schools to participate. But then on top of that, we also have, like Gardner, we have Project AMP and I Decide, which we're just starting to implement. And then we have two other programs, Reach and Path, which are really, they're community-based, but we do have some memorandums of, understanding with schools, so we can go in there and deliver services. And that's really focused around a case manager connecting, the youth and family to resources in the area, helping children, learn to manage emotions that lead to problems in, a school setting or in a community setting or anything like that. And then I guess probably the curriculums we use is kind of like a mix of everything, but we use safe dates as needed, not, necessarily throughout the whole year, but typically what they'll do is the school-based programs will run a group, for those interested in participating in something like that. We have Positive Prevention Plus, which they kind of integrate into different, sessions or group meetings or things like that. And then we just started using Catch My Breath, which is to address, vaping and the horrific consequences of that in a positive way, though. So if, I will put my information in the chat also, but if anyone has any questions, you can just reach out to me.
Thanks, Amy. Sorry about the wasp nest. I know we're losing Mark, if we haven't already lost him. And I did want to ask, Amy, that was a good transition. A lot of these programs are brought in, from an outside organization to be delivered at a specific time in schools. There are also a lot of programs that are embedded school-based health and mental health services. And I think that for schools that do not have embedded school-based mental health services, what can somebody kind of speak to what that looks like? What are the most important things to know for schools that may be considering adding these services? I think specifically, I'd like to hear from Christy about that because they do school-based telehealth. So if you could speak a little bit to like what kind of space is needed, what kind of supervision is needed.
Sure. So, we started working within our, specifically the Gardner School District. We started back, I think, in 2014. And over the years, we kind of learned what worked and didn't work with having our staff embedded into the schools. So now that we're here in the schools and in 5 different districts, and I think I'm in almost a dozen different schools, we really have found it extremely helpful for our staff to be in there full time for access, not only for the students, but for the families, for the teachers, for the school community itself. Our staff have school email addresses because what we've found is that a lot of schools will block outside emails from coming in. So our staff have phone lines from the school. We have email addresses from the school, so everyone can find us pretty easily. We also have permission to be part of the school's information system, so we can coordinate our care without having to kind of go bother the other school staff. Our presence in the school, we've always said, shouldn't be a burden. We should actually be a benefit. So we don't want to add more work having us in the school and interrupting the school day. So our school staff are very self-sufficient by being able to look at a student schedule, whether they're absent or they're in, grades to follow along with grades and any disciplinary things that may be happening as well. We also attend IEP meetings, 504 meetings. So again, our school-based staff are very embedded in the schools. They have an office space. The schools that we provide mental health counseling in, we do not have a big sign on the door that says this is the mental health counseling room. We try and keep our confidentiality as much as possible and really make our offices a little bit like you're stepping outside of school. So they're very comfortable with fidget toys and art supplies. And if you want to sit on a ball, one of them has a basketball hoop in it. I mean, whatever the kids are looking for, we try and make it as comfortable as possible. And again, our school-based staff really are there full-time to really coordinate care and continue that ongoing communication. Because what we've found in the past is when you've had people kind of bouncing in and out of the schools, let's say you have a mental health counseling session and the student sent back to class, were they okay to go back to class? Did they have an emotional session? Our community health workers are there to kind of support those students, make sure they're okay to go back to class. And if they're not, there is somebody that can stay with them and spend some time with them. So we're not putting a child back in class who may feel a little over emotional at the moment or have had some difficult discussions previously. So that's really a quick overall. It's a lot of flexibility, it's a lot of communication, and it's a lot of care coordination, but it's huge to work with the school itself and be part of that community.
Thanks, Christy. Does anybody else want to talk about what embedded school-based services look like, or perhaps things that you think schools need to know if they're considering embedding school-based health or mental health services? And if not, that's okay. And
I forgot to mention that our community health workers, our community health workers and our mentors, those are grant-based positions because they're not a billable service. So we do depend on grants to pay for those positions. But then any billable service where they're pretty much paying for themselves most of the time, pretty close to covering our costs in that area. So we do depend on grants to have those positions.
Thank you. I do have a couple of other questions. I'm also looking at, I know we're close to time. We might run just like 5 minutes over. I wanted to ask if anybody has feedback that they've received from schools about the experience that schools have had with bringing in these programs. Any recommendations for schools as they bring in programs, anything that they've heard that would really be, encouragement that you would want to pass on to schools that may be hesitant or have concerns about bringing in certain programs. I think some of what all of you have touched on is how the level of control that the school itself can have in terms of which modules they want delivered, how they want it customized to their own population and students, that they are, in the room, that we actually want them to be in the room while programs are being delivered. Is there anything else that anybody wants to say they've seen as a result?
Yeah, I would say, as I wanted to add, and I kind of mentioned it when I talk about the programs. I don't know about the other programs, but it's pretty easily to embed in what's already happening in a classroom and what the teachers already, what the curriculum already covers. So I would encourage, people to look at it as an enhancement of what's already being done. Because, in a health class, like, Rose and I work close together in the same school, and in health class, they will cover, healthy relationships and all that stuff, but this is just additional to it. So, working closely with a teacher was, it is the way I go, because then you can really make it, of course it has to come from the top, from the superintendent and principal, but then really the work is being done with the teacher and embedding it in the classroom, wherever it fits the best. You're already talking about healthy relationships or bullying or whatever, and I think in my experience that works the best. So finding a way to already, supplementing what you're already doing.
I'll also jump in to say that as we've grown, because we started in just a one or two sites, and as we've grown, we've really put ourselves actually in front of the school committee to talk about what we have available and kind of grew from there. So I know Michelle asked about getting into different schools, but I really would encourage kind of talking with school committees as well as superintendents, because that's really where you get your foot in the door to see what fits their school needs in their world.
Because of our sensitive topics that we have a lot of experience in being very creative in different ways that we approach parents and superintendents and schools. And every school is built a little differently, and it can be a big challenge. I did not say when I first spoke, we also do pre and post surveys, which can be a challenge for us sometimes. We do have an opt-out letter, so any child that takes our curriculum or minis has an option to opt out, and that is always sent out prior to coming in. But since the standards in Mass for sexual health have recently changed, there's some topics that are now mandated. And like Veronica was saying, a lot of these topics are, or I would say almost all these topics are already being taught. We're just coming in with a little bit extra information, different speaker, and being able to co-facilitate with the teachers, really to give them some more extra information. We also offer parent workshops, which can be helpful sometimes if the parents are very curious on the curriculums we're using, or what we actually are doing or talking about in class. We've been doing these on Zoom because the attendance is a lot better there. But that's an option too for schools to use if they're having a lot of parent pushback. So we get very creative with how we might get in different districts.
Yes, and another thing that we do, like what we all saying, the teacher maybe teach this lesson, but when we come to the classroom, it's different environment. Even the teacher says all the time, like, oh, it's a different person. Maybe they listen to you guys better. Another thing is we do a lot of activities. We do a lot of games. We do a project like for Sexual Assault Awareness Month that is in April. We try to do a project like around the school. The students will do poster and put it around the school to create awareness. At the same time, they are taking a stand to create awareness for sexual violence. Or Teen Dating Violence Awareness Month, we try to be creative and doing movie screening or games and other things.
Thank you so much. All of those answers kind of lead me to my last question for the panel, which is, what do you think are some best practices or maybe words of advice on communicating about health and prevention programming with internal staff, with students, with caregivers, and with like the school community and community members at large? You don't have to address all of those, but if you have any specific, words of advice when talking about prevention programming, and especially, in regard to pushback or concerns that different groups may have.
I think we all kind of, well, I didn't speak the last one, but everyone else kind of said a big part about coming in as the extra and kind of enhancing the curriculum. So for internal staff, we're here to support you. They're not necessarily completely knowledgeable in these different aspects. So bring in the professionals who are these are our specialties. And we can add so much more meat to that curriculum. I know we used to do for Leominster High School, we used to do for the social work and psychology classes, when it would come to domestic violence, she would bring us in and we would teach that curriculum to them. And then we would always wrap it up where they would do a poster contest and they would create posters from what they learned from that programming. And then we voted on and people got prizes. It was great. They loved it. They really, really enjoyed it. And it was also their way of giving back to the school who didn't get that because they weren't taking those two classes. So these were posted throughout the entire school. So I think that's one of my biggest things when people are giving that pushback of, I don't have time for this. And I get it, teachers have a lot on their plate. Let us help. Let us be your support.
I also find as a, number one, as a provider, but also as an educator, because as a nurse and as a nurse practitioner, part of my job, big portion of my job is education, along with Rose and what, Ron has been trained to do. I always have found, honesty to be the best policy. I don't necessarily sugarcoat things. We are not encouraging, and I think that it's very important that we help parents and help students and help staff understand that we're not encouraging adolescents and those that we're teaching to participate in a particular behavior. We're not encouraging that. What we're doing is giving them the tools, the education and the tools necessary for them to make an educated decision prior to engaging in a behavior. It's not my job necessarily to look at an adolescent or look at anybody and say, you should not be doing this. You should not be having sexual intercourse. You shouldn't be doing this. You're underage, you're XYZ. My job is to help identify and discuss potential harmful behaviors, why they could potentially be harmful, and to give them the tools to help them make an educated decision from that point on. And I know a lot of parents, I think we get a lot of more parental pushback. And that's my job is to try to ease that for the parents. And sometimes it's, heck of a lot easier said than done. But we just do the best we can and just try to give everybody the tools they need to make that educated decision.
And I think something important that you alluded to but didn't necessarily say was that schools can, if they are getting, because they're going to be the ones who get that phone call, right, from a parent. You're not going to get that phone call most likely. So they can kind of defer those questions to you. Like, these are the people who are implementing the program. I assure you that they're professionals and they know what they're doing. If you have concerns, please contact them. I assume that is the case. Anybody else want to jump in on, what they'd kind of like the public or students or anybody else to know about bringing programming into the schools?
I just want to, not necessarily this, Chelsea, but I just wanted to add too, so like besides of the curriculum that, we all teach at the different topics and stuff, we also bring wonderful speakers to and presenters to the schools, so it doesn't have to be curriculum, but if there is a topic that the school is teaching or have a rally or some sorts of and looking for speakers, there are wonderful organizations, local organizations there. They have members that are willing to come speak to youth about their experience and their lived experience, and that's priceless. Those are always very popular because they're very real, and the students really appreciate and recognize that this is a real person with a real, background coming in and sharing experience with them. So please reach out to your person. We're all connected, so so any of us, if I don't know someone who can speak on a topic, Rose might know someone, or Chris will know. So there's just there's yeah, we all know each other, so just reach out to one of us.
I think that's a wonderful way to kind of recap what Tara said. We're here to support you and to make your lives easier, and to be a resource. So thank you to everybody. This was I think that was a wonderful way to wrap this up. And feel free to contact everybody's contact information, I think, is in the chat. There's also a post survey link that we would love for you to take. So we have in the spirit of collecting data, so we know what you thought of this presentation, and we will definitely be sending this out to all of you and to all of our schools. It will also be accessible on our website as a link, so anyone who wants to access this as a resource can do so.
And if you all, as panelists, are okay with it, I'm planning on kind of compiling all of the resources that we just mentioned to send out with the recording. And I'd love to take all of your contact information from the chat and get it into that as well, so that it's a little bit easier to manage. I know we have quite the chat going on.
Thank you so much to everyone, to all of our panelists, to our keynote speaker, Mark, and Olin for all of the work that was done on that toolkit. Thank you to everyone. I think this was a really great discussion. Hopefully gave some folks some really good resources. Have a wonderful rest of your morning. Thank you for your time. And we'll close it out.